Nursing evolved from an informal and unregulated practice for centuries. Leaders such as England's Florence Nightingale, considered to be the founder of modern nursing, saw a need to formalize education and set high standards for practice. In America, nursing leaders saw not only a need to formalize education and set high standards for nursing practice, but to seek regulation through government and hold individuals accountable for their practice. Professional nursing had its beginning in Alabama in 1888, when 3 trained nurses arrived in Birmingham from the old Blockley Hospital in Philadelphia to take charge of the almshouse. Soon, other nurses followed in large numbers, and physicians' offices and hospitals in the state established training schools. The supply of nurses grew rapidly. The quality of nurses entering the state was of concern to resident nurses, and the training schools were often questionable. A group of concerned nurses in Birmingham organized in 1913 and took measures to seek state government regulations for nurses and to protect the public against imposters. The legislature of Alabama responded to their efforts and passed the first Nurse Practice Act in 1915, thereby establishing a Nurses Board of Examination and Registration of Alabama. Governor Charles Henderson signed the bill into law on August 6, 1915. The state's legislature and subsequent governors have continued to support the efforts of the board to promote the public's safety and welfare. Today's Board of Nursing takes seriously the challenge and responsibility of regulating nursing practice and education. From its humble beginning, meetings were held in 4 different locations around the state with no specific headquarters. The Board of Nursing is now centrally located in the state complex near the Capitol. Earliest minutes show that the first official meeting of the board was held at the Tutwiler Hotel in Birmingham on November 23, 1915. The first members, 2 physicians and 3 registered nurses, were appointed by the governor on October 28, 1915. One of these was from the Alabama State Association of Graduate Nurses. The first item of business was to decide on the rules governing the board. The first president of the board was Mrs. Lemoyne Ferries, and the first authorized secretary of the board was Miss Helen McLean. Miss McLean was paid $75 for the year for her services. Miss McLean was bonded for $1,000 by Fidelity Deposit Company of Maryland. The 1915 law focused heavily on entry into practice, specifically the regulation of nursing education.
So nursing education was really at the forefront in this particular decade.
At the first meeting in 1916, 14 schools were approved, the first of which was St. Vincent's Hospital Training School. The first board was forward-thinking. Dr. J.N. Baker moved at the 5th meeting in 1917 for Alabama to make an agreement with all states desiring to have reciprocity whose standards are equal or higher. The same board set the standards for curriculum requirements for training schools. They planned the first examinations.
What we have record of is a 1919 test that for the licensure, and the exam was handwritten, and it was discussion questions, and it talked about obstetrical nursing, surgical nursing, and hygiene was one of the other topics, and there was one more, but they were specific discussion questions, which is certainly different from what it is now. Now we have gone to multiple choice items, and we are actually doing computerized adaptive testing.
In 1921, Dr. Lena Denny, now recognized as the first executive officer of the board, actually started as the secretary on the board. Her career is described in the 1929 American Journal of Nursing as epitomizing the history of nursing in Alabama.
I think the main thing is to put your whole soul into it and regard your patient more than anybody else. That's the main thing, to regard the patient. The patient is the one that is the one to be cared for and looked after. And anything that can contribute to that end and not make the expenses so high that only the rich can afford the nurse.
Dr. Denny was recognized at the state and national levels for her business abilities and leadership. She held at one time 3 offices, 2 of which were Executive Secretary of the State Association of Graduate Nurses and the Executive Officer of the Board. Her dedication was such that she contributed a room in her home as the first office of the Board. In 1923, her salary was set at $250. Under her leadership, the Board's activities assumed structure in matters of licensure and regulation of education. Operations became more formalized. The nurses themselves, once licensed, were active in practice and responsive to national interest. As the Board entered the 20s and 30s, collaborative relations with physicians continued.
In the 30s, of course, we were dealing with the Depression. There were continued education reforms, refinement of those reforms.
Concerns about curriculum were considerable. In 1931, a group of physicians asked for a conference with the Board and made a plea for education for all nurses. Matters of discipline began to emerge in this era. The Board employed a lawyer, Mr. Ferris Coleman, prior to 1922. Records show that discussions were held with him regarding matters of discipline and legislation required to amend the laws. Disciplinary cases were few. Although it had been presumed that earlier cases were managed by the Secretary, the first case mentioned in the minutes occurred in 1928 in reference to drug addict, in which the individual's certificate of registration was returned. In 1932, a letter of complaint of immoral conduct was presented, and the license of that nurse was revoked. Due process was followed. Today, matters of discipline are extensive.
We have about 1,000 complaints a year that are made to the Board from various sources, and once those complaints are logged in, then we go through the complaints, assign them to an investigator, review the investigations, draw up formal charges, and then I prosecute those cases before the Board.
Okay.
So she's been convicted on some, and some were dismissed.
Right, and then she's been telling a fib to us.
Okay, so all she's got are worthless check convictions, but she lied on a renewal form.
Exactly.
In 1939, 2 events occurred that began a reshaping of the first Board. Miss McLean died, and Dr. Denny retired. At this time, one of the physicians was replaced by a nurse on the Board. In 1942, the title of the Board was altered to be the State Board of Nurse Examiners. The war years were in full swing. The state licensure examination, previously handwritten in essay form and written by the physicians, now is contracted by a national board under the National League for Nursing Education. There was also a new challenge on the educational scene.
In the 1940s, the war years really was a signal both in terms of that public policy about war and also policies regarding education primarily. The Cadet Corps emerged. The federal government had an interest in assisting schools in educating nurses faster so that the war effort could be supported. And also, in the 40s, we were looking at a great influx of hospitals. Many hospitals were being built. The veterans had to be cared for. Women were entering the workforce in greater numbers, and that was reflected in nursing also.
The war years had taken its toll on the numbers of nurses available. A study indicated a need for a second level of practitioners. What had previously been a board of nursing for registered nurses became one for RNs and LPNs. Licensed practical nurses entered the scene in 1946. The first were accepted by waiver.
And it was mandatory for practical nursing also. Well, we had to grandfather these people in, and that was a big struggle, particularly for practical nursing.
At the same time, a curriculum was being developed for LPN programs. The first LPN programs were in Birmingham, Gadsden, and Dothan technical schools.
I was hired by the State Board of Education to teach practical nursing. It was then known as School of Trades for Negroes in 1950, where I met Miss Frances Whitten, who was executive director of the Board of Nursing located in the Woodward Building in Birmingham.
Up through the 1950s, hospital schools of nursing conducted most of the education for registered nurses. Tuskegee University offered the first baccalaureate degree program in nursing in 1948. In the late 1940s, plans materialized to implement the first state-supported nursing education program that offered the baccalaureate degree. The University of Alabama School of Nursing opened in 1950 under the leadership of Dean Florence Hickson.
In the 50s and the 60s, we continued to see a lot of emphasis on education. We were beginning to look at master's education, differences in specialty areas. We were also beginning to look at practice. What kinds of practice modalities do we need for nurses? And so we were looking at baccalaureate nursing education versus 3-year education, and so we were really concentrating on that.
Overlapping the mid-40s, 50s, and 60s, societal changes were occurring that impacted the laws governing nurses. Antiquated laws were examined and changed through the efforts of concerned nurses. Physicians were no longer appointed to the board by 1965, and matters of segregation were addressed.
Well, I was appointed by Governor Persons in 1953, and life was very simple in those days. We had very few disciplinary problems. Bad girls and boys were not reported, and mostly girls. Very, very few were ever disciplined because we had, the law did not provide for that. We did have, of course, licensure problems, but that's ongoing. That was ongoing through the years. The 1965 law did away with a very antiquated section of the 1945 law. It was section 19 and a half, and you probably did not know this existed. It says, no person or corporation shall require any white female nurse to nurse in wards or rooms in hospitals, either public or private, in which Negro men are placed for treatment or to be nursed. Did you know that? And no white female nurse shall nurse in wards or rooms in hospitals, either public or private, in which Negro men are placed for treatment or to be nursed. And then it gives the, well, not much violation. Upon conviction for a violation of this section, the court shall assess a fine of not less than $10 or more than $200, and it may also, as additional punishment, sentence such persons upon conviction to confinement in the county jail or to hard labor for the county for a term not exceeding 6 months. Well, of course, the nurses in the state did not abide by that section of the law for sure, because we just didn't. we just went ahead and nursed everybody.
Meanwhile, LPN nursing education grew in promise and popularity. Graduate LPNs organized, and in 1965, the first LPN was appointed to the board. Mrs. Mildred Westmoreland attended her first meeting in January 1966. At first, they did not have a vote on the board. Then, as time progressed, the vote was allowed for matters affecting LPNs. Today, LPNs have assumed a full participatory role on the board.
they in turn, they review the members and submit the 2 names to the governor for appointment. And out of the 2, 1 name is selected as the appointee.
In the 1960s, focus of the board was on the egalitarian movement in education. Mrs. Mary Catherine King describes the educational challenge.
Well, I guess it was the onset of the junior college programs and the nursing programs. To me, that was one of the biggest problems, I guess you can call it a problem, that the board had, a challenge that the board had to deal with.
While education was a major focus for board decision-making, the board also was confronted with an increase in disciplinary matters.
Mostly drug problems, RNs, and it's sad to say it was a lot of RNs that were brought before the board they'd been reported for misuse of narcotics, and I was on the board when we made the decision to revoke licenses.
Although the board had, from the beginning, interacted with the legislature prior to the 60s to ensure the requirements of the law were met and necessary changes were made to meet societal demands, the board became more politically conscious to achieve its functions. Mrs. Mary Catherine King describes, with humor, one event.
And we lived through our meetings with Governor Wallace. I have to tell you a funny story about him, if you'd like to hear it. We were meeting, this was before he was shot, you know, and he came in the board in that room. We were all sitting around the table. And he went around and asked each one of us personally if he had appointed us to the board. And we thought, oh goodness, you know what? And fortunately, it was right after he had appointed me, so I could say, yeah, well, yeah, you appointed me to the board. So after he had made his rounds and asked everybody, and he came back and sat down and he talked, and then he said, well, girls, and he called you girls, when you leave here, you go out and you give my secretary your name and address. And I said to Betty Tomlin at the time, I wonder what he's going to do to us now. He made us all staff members on his staff. So we were on the governor's staff, and he sent us each a diploma and a license plate to put on our license. And I said, I'm not going to tell anybody that I'm on Governor Wallace's staff. And somebody said, you better do it, because we're running up and down this highway between Birmingham and Montgomery. If you want to go 60 miles an hour, the troopers will never stop you. So I used that lieutenant on the governor's staff thing as long as I was on the board. Then I took it off.
In the 1970s, a critical legislative move that involved the board was made to assure that schools of nursing help prepare qualified teachers. Special legislation was initiated to provide scholarships for selected and qualified applicants.
These scholarships had to do with funding for nurses to earn a master's or a doctoral degree in nursing.
In the 1980s, practice emerged as the major focus of the board.
I believe the Alabama Board of Nursing's move to mandatory continuing education for the relicensure of both registered nurses and practical nurses was a significant event. It was mandated by the Sunset Committee, and certainly the Board of Nursing believes in continuing education as one measure of ensuring competency. We were thinking of moving in a different direction that we believe was a greater guarantee of competency than CE, but we chose to, at that time, go with continuing education as a means of trying to guarantee public protection.
There was a conscious move toward interactions at the national level and becoming more astute to political obligations and public accountability. Discipline concerns continued to grow.
There were a number of changes in the early 80s. One was the passage of the Administrative Procedures Act. The board already had procedures and processes in place to handle disciplinary cases, but the Administrative Procedures Act really required us to go back and rewrite our rules and very definitively establish the process that we followed in here in these cases, from the time we received the complaint to the actual action. So there were many changes made because of that act. Our rules and regulations had to be completely rewritten and expanded to cover the due process for the licensee. Because of the increasing number of complaints, the staff that we had, there was no way that we could handle it. In the past years, there had just been a couple of professional staff, and we did everything. But we had to employ additional professional staff people to handle the investigations. We had to employ attorneys, which we had never done before, to help us address these issues.
The 90s show a proactive thrust of all board members, with an inclusive membership of representatives from licensed practical nurses, registered nurses, advanced practice nurses, consumers, men and women. Issues are addressed in lengthy meetings.
I sort of, in my mind, characterize the 1990s as really looking at the specialty practice and also the kinds of forces, both political and otherwise, that surround the healthcare delivery system.
We are fortunate here in the state of Alabama that we have one board, and my voice and vote is just as important as a person that has a doctor's degree.
The most critical issue is one that's kind of in limbo as far as we're concerned, and that's the multi-state issue that's kind of up and on the table.
In response to growing concerns about public protection and consumer rights, a new consumer member was appointed to the board in 1998.
It really has not made much difference to be the consumer because we all have the same job, which is to protect the public. The only difference is occasionally I have to remind them that something that they're saying sounds like they're trying to protect a nurse or think about the nurse's livelihood, and just gently remind them that our first concern is the public, its safety, its welfare, and its health. But that really is the focus of every member of the board and all the staff.
Issues of scope of practice, expanded practice roles of nurses through advanced practice have led to the addition of 2 advanced practice nurses. The laws now reflect a collaborative practice with medicine.
There are 4 advanced practice nursing categories in the state of Alabama. 2 require collaborative practice and work through the joint committee with the Board of Medical Examiners, that being certified registered nurse practitioners and certified nurse midwives. There are 2 non-collaborative, that is, they work reasonably independent of that kind of an arrangement. That would be the certified registered nurse anesthetist like myself, and also the clinical nurse specialist.
We are nurses, and we are under the provision of the Board of Nursing. So therefore, they regulate the nursing activities or the CRNA activities as they do all nurses.
Gregory Howard is the second male to be appointed to the board. He has served as an officer of the board for 4 years. His leadership abilities have led to a director's position on the board of the National Council of State Boards of Nursing.
What I envision is that this board will move ahead with continuing to protect the public in the most effective way that it can. So progressive and out-of-the-box public protection is what I look for the future.
Practice issues have become more complex as healthcare delivery has changed. B.J. Sharath, Dee Newman, and Jeannie Sewell are already working futuristically in matters of nursing administration, quality management, and informatics.
I think there are a number of critical decisions that we've made related to practice issues for nurses in the state of Alabama on a broad scale. And I think there are critical issues that we have made related to a single nurse in terms of practicing in the state of Alabama.
New leadership is dynamic to meet current challenges.
The biggest challenge has been working with a diverse group of individuals and groups. I think the board has worked quite hard to remedy that and struggles daily to improve upon that. The different people who are interested in nursing or who are affected by nursing.
As we approach the new millennium shortly, we'll see that we build on the history of nursing and what the Board of Nursing has accomplished throughout the years of its existence, and there will be future things related to technology, future issues related to technology and the practice of nursing throughout the country that impact the practice of nursing in Alabama. That nursing education is always an issue. Dealing with nurses and licensure and how to get that accomplished are all factors that will be included as we enter the new millennium.
Through the years, the Nurse Practice Act has focused on public protection. Today's board honors the strides made by the pioneers of nursing regulation. Their foresight of organizational needs, political finesse, sensitivity to emerging issues and the human condition, and their responsiveness to societal changes set the direction for the future.
The practice of nursing is constantly evolving as new technologies, medications, diagnoses, and changes in healthcare require nurses to adapt to their professional environments. The board regulates the practice of licensed practical nurses, registered nurses, and advanced practice nurses. The standardized procedure process helps the board adapt through the years and bridges the gap between initial nursing education and evolving practice realities. Since the standardized procedure rules were first adopted in 2001, the board has been reviewing and approving standardized procedures submissions to ensure that they are within the scope of nursing practice. By the mid-2000s, and in response to national concerns about an impending nursing shortage, the board established the Center for Nursing. The center's objective included contributing to the scientific body of knowledge regarding nursing matters by conducting nursing-specific research. The regulation of nursing education continues to be one of the core functions of the board. Now, however, the board isn't alone in safeguarding the quality of initial nursing education, as national accrediting bodies have emerged through the years to ensure the quality of nursing education in Alabama and throughout the nation. The new millennium brought about many technological changes in healthcare and in homes around the world, and the Alabama Board of Nursing didn't lag behind. Beginning in the early 2000s, RN and LPN license renewal processes were transitioned from a paper process to an electronic one. Today, renewals are processed even more rapidly, as nearly all board transactions are completed online. Unfortunately, as it has been throughout the board's history, substance use among nurses continues to be a problem, one the board deals with frequently. While substance use is the most common disciplinary issue encountered by the board, there is no indication that it affects nurses at a higher rate than the general population. Although substance use is a common cause for discipline of a nurse's license, the board is authorized by law to employ a non-disciplinary alternative for the early identification, intervention, treatment, and rehabilitation of any nurse who has impaired competence due to substance use. Nurses who suffer a physical or mental condition may also be eligible for the non-disciplinary program. The board has always strived to be forward-thinking. In 2001, the board was recognized for regulatory excellence by the National Council of State Boards of Nursing. In 2015, the board celebrated its centennial year and has charted a course in a new direction toward greater inclusion and collaboration with nurses and the public. One of the members on the board at the time of the 2001 award later returned as a board staff member and eventually became the executive officer in 2015. The board's work continues, ensuring that Alabama citizens are protected by consistently educated and duly licensed nurses. Communication and collaboration with nurses, citizens, and legislators will ensure that the board is ready for the next century of nursing in Alabama.